We'd like to welcome you all to our Lupus Foundation of Northern California's interview with Dr. Bush. Dr. Tom Bush has been a longtime supporter and medical advisor to the Lupus Foundation of Northern California for many decades. We're very grateful to have him offer to answer the most frequently asked questions we are receiving from lupus patients throughout the country. Dr. Bush, thank you very much for joining us today.
You're welcome.
It is Friday, April 3rd right now, so we may do another one of these question answers as this coronavirus issue continues to increase in urgency. But the first question we'd like to ask Dr. Bush is, what is the COVID-19, also called the coronavirus, please?
Yep. And actually, before I begin answering questions, I just want to make it clear that I'm a clinical rheumatologist. I'm not an infectious disease expert or a public health expert. So I'll be giving you opinions and things that I've gleaned from the reading the literature and listening in on some conferences. But please make use of the excellent websites. There's a website for the County of Santa Clara, also the state of California, the CDC nationally, and so forth, to get up-to-date information. And also, as you just mentioned, anything that we're saying today may be out of date in a week. So keep posted with the information you're getting from the news media and from those websites. Okay, so why don't we go ahead and proceed?
Yes,
so the first question was, what is the COVID-19? And this is a virus that first emerged in China in December of 2019. It's in a family of viruses that are known as the coronaviruses. And coronaviruses encompass a wide variety of viruses that we do encounter at times, and some of them just cause symptoms like a common cold or flu that are not very severe. There have been 2 prior outbreaks of severe infections that are considered pandemics, or they've spread over the world from coronaviruses. One was called the SARS virus, and it started in China in 2002. And it did spread around the world, but not very many people got infected compared to where we are today. There was another one called the MERS virus that started in Saudi Arabia in 2012, also spread around the world, but at much smaller numbers, although those viruses were very dangerous. So the COVID virus is a new or novel virus that has come up from China really in the last 6 months, and now, as everyone's aware, is spread worldwide.
Thank you, Doctor. Another question we're receiving is, how dangerous is the COVID-19 and how does it spread?
Well, in about a quarter of people, they get very little symptoms. So in some people, they can get infected and actually can be contagious to others, but have very little in the way of symptoms. About half of us, when we get infected, will come down with flu symptoms, fever, aches, and pains, and recover over 2 to 3 weeks. The reason this virus is so dangerous is for the last quarter of people, they can get very ill and they can develop a viral pneumonia that can lead to respiratory failure and the need for hospitalization, a ventilator, and they can die from it. As far as the risk factors for it, the ones that are quite clear are age. As people get older, particularly into their 70s and 80s, they're much more susceptible to the severe complications. Men tend to do a bit worse than women. And so far, we've identified what we call comorbidities or chronic illnesses that people have that make them more susceptible to a bad outcome. And so far, that's mainly hypertension, diabetes, heart disease, obesity. We do suspect, based on our experience with other diseases, that immunocompromised people may be more susceptible, but there's really not much information on that yet. As far as how the virus spreads, it's like other colds and flus. It's mainly respiratory droplets, that is, people coughing and sneezing and getting contact with the little respiratory droplets that have some virus in them. But also it can be spread by contact. The virus can persist for a while on hard surfaces like plastics and metals. So if you come in contact with those with your hand and maybe bring your hand to your face, you can inoculate yourself or get an infection through that route.
Very good, thank you. Another really urgent question is, how can individual patients and all of us protect ourselves from and our family from getting COVID-19?
Yeah, well, unfortunately, as you're probably aware, there's really not much in the way of definitive medical therapy or vaccines yet. So really all that we can do is avoid getting infected, avoid coming in contact with people that have the virus. One thing that makes this virus particularly dangerous is it seems to spread very quickly and to many people. So one person that's contagious can infect a wide number of people, much more so than a lot of other viruses. So the main thing is to try and avoid contact, and that's where in the Bay Area and California and in many states, they've begun the shelter in place, meaning stay in your home, avoid contact with other people. Don't go out of the house unless you need to go for a medical visit or for groceries or cautiously for exercise. And what this does is it just avoids you contacting people that may be infected. This doesn't stop the virus completely, but it slows down the transmission. And what they're really hoping to do is avoid a surge where thousands of people get sick at the same time and need a lot of medical care. And that's, of course, what we've seen develop in Italy and Spain and in New York City to some degree. So we're trying to avoid that surge so we don't overload the hospitals. What'll happen is a number of people with the shelter in place will still get infected, but it'll be over a gradual period of time so the hospitals and the infrastructure can manage that so we can more safely take care of people that get sick. And hopefully less people will get sick over time.
Great, that's very helpful. Go ahead.
Yeah, and then of course, when you go out, the rules that everyone knows: stay 6 feet away, wash your hands frequently. If you're touching objects, try not to touch your face afterwards unless your hands are washed. And if you cough into a napkin, which you dispose of, and then wash your hands, or cough into your elbow if you can't cough into a napkin. So those are the general safety measures for anyone.
That's very helpful just to remember and keep reminding ourselves of those details. How long do you think the shelter in place will last?
Well, the first shelter in place in the Bay Area was, I think, 2 or 3 weeks.
Mm-hmm.
And that's based on sort of the replication cycle of the virus. They think that once someone gets infected, they'll be sick with the virus or contagious for maybe 2 or 3 weeks. So hopefully, with the shelter in place going on for 2 or 3 weeks, it would get through a sort of a life cycle of the virus and start slowing down the transmission. Since we're still seeing new cases evolving right now, they've imposed an extension of that shelter in place to May. And I'm sure what'll happen is in late April, they'll be reevaluating where we are at that point in time. If we're seeing a dramatic drop in cases, perhaps they can start lightening it up, or they might extend it further.
Great. Could you please remind us, what are the early symptoms? We've heard some conflicting information on that from the news, but what are the early symptoms of COVID-19?
Yeah, my understanding is that the early symptom for the first 3-4 days is fever, aches, and pains, and then that's followed by a dry cough. And if the disease becomes more serious, then that's followed by shortness of breath, trouble breathing, maybe within about a week of developing symptoms. And if people get that shortness of breath, that's often when they need to be in the hospital.
Mm-hmm. What should we do if we think we or a loved one is infected?
Well, the first thing to do is to do the shelter in place and not to go out in the community and cough on people to perhaps spread the virus. Then you really need to contact your primary care provider, or if you have lupus, your rheumatologist, and let them know what symptoms you're having to help them work through that. In general, if people are just having fever and a dry cough and are not feeling short of breath, they can probably stay at home. Obviously, if you start getting severe shortness of breath or other symptoms, you may need to call your emergency services in your area and ask them what you need to do next.
Great, that's very helpful. What kind of medication should I have at home to treat the virus?
Well, really, there's nothing specifically to stop the virus that you can use, but if you're having a lot of aches and pains and fever, you can use acetaminophen or Tylenol. There has been a little information or perhaps misinformation out there about using what we call NSAIDs, or the Motrin and naproxen type of medications. And there's some theoretical reasons to think that it might worsen infection, but that we haven't seen that in practice. So at the moment, the authorities that I've seen have not recommended particularly avoiding those medicines.
And how would a patient know, or if they or one of their loved ones, family members, should go to the hospital?
I think mainly it's if a person starts developing shortness of breath, because that's a bad sign that it may be developing into a viral pneumonia. They might need more care. But as always, they need to contact their physicians or their emergency services to get advice. directly related to their condition.
Great. Are there any medical treatments or vaccines for the COVID-19?
Well, at the moment, there's nothing proven. There are a couple of medicines that are being tested. There's an antiviral medicine that helps to slow down viral reproduction and replication. That's an intravenous medicine given in the hospitals, and there's some reason to believe that it might help, but so far the studies are early and we really don't have any results yet. We probably will get some results in the next few weeks regarding that particular medicine, whether it might help. And then, of course, for lupus patients, you're well aware that Plaquenil or hydroxychloroquine has been used fairly extensively with the hope that it might help with the infection. In a way, this is not too surprising with a medicine like Plaquenil, because it's the original medicine, the derivative it came from was chloroquine, which was used to treat malaria back in World War II. And actually, when they were treating millions of troops to prevent malaria with chloroquine, they noticed that some people with lupus got better. And that's actually how chloroquine and then later Plaquenil became a useful medicine for us to treat lupus. So it does have some anti-infective properties. And back in the earlier coronavirus pandemics, there was some lab data that suggests that medicine like Plaquenil might help slow down viruses. So far, all the enthusiasm for it in the COVID-19 pandemic has come from a very small study in France where they had about a dozen people on Plaquenil. Some of them dropped out because they got sicker and they weren't included in the final results, but they did see a drop in the viral levels in these people that was rather impressive. So there's a possibility that it's helpful. There's a lot of ongoing studies now, and probably within a few weeks we'll have more information about whether it's useful, and if it is useful, is it better for the early part of the disease, middle disease, late disease? Right now we just don't know.
Thank you. That's probably one of the biggest questions we get most frequently. And are lupus patients at a higher risk of COVID-19?
Well, that's it's an excellent question, and so far we don't know. The reason we don't know is mainly that the data is all just coming in very quickly. It's all very new. We're getting information on people with heart disease and diabetes, which are very common, but lupus is about 1 in 1,000 people. So if you have a report of results of 5,000 or 10,000 people that got infected, there's not going to be very many lupus patients in that group. So at the moment, we really don't have much information going either way, saying that lupus makes you more susceptible or less susceptible. Probably within a month or two, we'll have more information.
Great. Now, how would a patient know whether it's a coronavirus outbreak or a lupus flare?
Well, that's another excellent question, and it's going to be a difficult one to answer. Lupus patients get flares, and sometimes the flares come with fever. Sometimes lupus patients have a flare that involves shortness of breath. So it's not going to be easy, and here I'd have to say you need to talk to your rheumatologist and have them work it out with you if you come down with a fever, and they may need to do some testing in order to help sort it out.
Great, thank you. And another thing, our foundation, one of our patients was on the CBS News here, and the biggest question we're also getting is, if Plaquenil is being treated for coronavirus treatments, and will it be at risk? Will I be at risk? Would our patients be at risk for access to this medication, to their individual medication?
Yeah, that has been a problem, and there's not a lot of people that use Plaquenil under normal circumstances. It's mainly lupus patients, and now there's lots of people that have infection that are using it or want to use it. So there have been some problems with being in short supply. I do know that the American College of Rheumatology and the various government agencies and various big pharmacy chains have been working to preserve some supply for lupus patients. And so you need to check with your pharmacy and your rheumatologist to see what can be done with that. Also, the companies that make Plaquenil, a lot of them have released a large number of pills to be distributed on the market, so that will help some as well. But it may be difficult for a few months to obtain medicine on a regular basis.
Can you contact the virus twice?
We don't know yet. It's possible. I mean, we're expecting that people, like with most infections, will develop immunity that lasts months or perhaps years. But we really won't know again until the late summer, once the first wave of virus is passed, to see whether people might be susceptible to a second infection.
Great. Can you get the flu and the coronavirus at the same time?
Actually, I think the answer is yes. I think there have been some cases documenting both. Hopefully the flu season will be passing by us soon, and we won't need to worry about flu as much. But it's possible to get co-infected.
What are the risks for a pregnant woman to contract the virus?
Yeah, I think to my knowledge, so far, we don't know. That's I actually was looking at some website yesterday trying to see if any information is available yet. And so far, there's nothing official out there as far as pregnancy and COVID virus.
Great. Will it come back again with the flu season?
Well, that's the next big question, and the scientists are wondering at the moment: is this seasonal? Will this be a something that recurs later in the fall again? And at the moment, they don't know, but they're certainly going to be watching very carefully for that. Hopefully, if it does come back in the fall, the second time around, we'll be better prepared for it, and a certain amount of the population will be immune, hopefully, at that time. So it won't be as severe of a pandemic as it is this time.
That's good to know. This is dated of April information as of April 5th. I'm sorry, April 3rd, Friday. So we want to urge everyone to please stay abreast of all these changes. And our foundation's continuing to monitor this and communicate with all of our patients and our patient community on this. So please let us know of any particular questions you may have outside of the ones Dr. Bush just provided us. But we may be doing one of these again soon if there's any changes. And Dr. Bush, we're very grateful for you for really taking time and monitoring this closely, doing the research and helping us with some of these really challenging issues that all of us are facing right now, especially our lupus patients.
Thank you. Happy to be of some help. And I'd like to emphasize, as all the health authorities are doing, shelter in place is the best thing you can do for yourself, for your family, and for the community until the danger is clear. Thank you very much.
Thank you, Dr. Bush. And we'll be in close touch and following this.
Okay.
Okay, I'm pausing it. Let me just make sure I'm doing all this right here.
You're a producer now.
Yeah, well, I was